Now, Dr. Ali Naqash, a professor in obstetric and gynecology from Royal College West Middlesex University Hospital. He will answer the question, is vaccine safe in pregnancy? Dr. Ali Naqash. Dr. Ali.
Hello, Marhaba, Dr. Thank you very much for the invitation. I'm just trying to now share my document. Let me know if it appears or not.
Yes, you can.
So do you see it?
Yeah.
You see it?
Yes.
Okay, it's fine. So let me yes, thank you very much for the invitation. I'm glad to be here. I know some of you, Professor Awaf and the others we met before. Lovely to be here. I'm obstetrician and gynecologist consultant, been in the UK now for over 30 years. I work in West Middlesex University Hospital in London. I also vice president of IMA UK. So I worked throughout these 3 waves, from first wave to second wave, and now we are the 3 waves. And what I noted, really, frankly speaking, now the 3rd wave is coming. Yes, the number of cases, confirmed cases, coming down, but the number of pregnant ladies with bad COVID is increasing. In fact, over the last 5 weeks, I personally was involved with 3 of them. And one of them is really bad, and she might need an ECMO. So essentially, some people say but the common thing among all these patients, they are all non-vaccinated. They are the pregnant women who were scared to be vaccinated, caught in the middle, got pregnant, and that's what happened. So these are some of the facts mentioned earlier on from last year about COVID and pregnancy. It was declared at that time that pregnancy is not particularly high risk for COVID. And usually pregnant women, when they get the COVID, you usually get it in the moderate to mild stage. And they describe them as clinically vulnerable rather than high risk. But we all know, being obstetrician, that pregnancy is a state of immunosuppression because the pregnant woman, her immunity is already compromised. So she would be vulnerable. So till now, they haven't confirmed any relationship between COVID in the pregnancy and complications like stillbirth or miscarriages. However, we seen personally, there are ladies who get COVID in the pregnancy who might be having more gestational diabetes and even high blood pressure. And the ladies I am seeing nowadays, they are in fact mostly white, even though when you read on Google, they say ethnic minority are more susceptible to COVID during pregnancy. Well, I work in an ethnic minority area, but most of the patients I'm seeing are white, really. And there are a few cases of COVID in babies. However, it can happen theoretically. So essentially what happened, our RCOG is our Royal College of Obstetricians and Gynecologists. It's the licensing body in the UK for obstetricians. It's a well-established organization back 90 years back, based in London, have more than 16,000 members all over the world. And the main target of this organization, obviously, is the advancement of science. I'm giving you this introduction about the RCOG because I'm coming to the recommendation of the RCOG now regarding the vaccination. So the latest recommendation of the college in July this year was that it is recommended, should be recommended, and women need to have it. That's a stronger statement than the one published in April. So now the college tried to push all pregnant women to be vaccinated, regardless of the stage of the pregnancy, whether they are early, middle, or late. And what they say that the evidence is overwhelming now. And I will talk about the evidence later on, how it started. And it's high possible, like the pregnant women should practice the same precautions non-pregnant women do, like the distancing, using the mask and all that. And in addition to the vaccination. And regarding women ask always, can I breastfeed or can I not? But now they recommend that they should breastfeed really. And there is an element that these antibodies, as discovered by the studies, can go through the breast milk. So the baby can get acquired protection as well. And there is some talk in the past about the effect on fertility, but now this has all been rubbished, and they think there is no effect of the vaccination till now on fertility of the women. So it should be very clearly explained to all of the women, all of the pregnant women, that there is the vaccination, and we're talking now about Pfizer or Moderna, not the other ones, because these are the ones which passed the studies. Before that, in April, this is how things changed. The recommendation of the college was slightly more cautious, saying should be offered. But now it's much stronger, should be recommended. And you even don't need to sit and explain to the patient the benefits and the dangers of a vaccine. In April, it was kind of, sitting on the fence and everything. And that's why probably so many women, pregnant women, wasn't vaccinated at that time. So what about the evidence? The evidence, which I would talk later, is very strong. And in fact, it's much stronger now, because till now, at least over 130,000 women, pregnant women, were vaccinated with the messenger RNA vaccine. You mean Pfizer or Moderna? And I heard that yesterday, the figure is in fact now much more than that, it's 400,000. So therefore, the recommendation of GCVI, which is the Joint Committee of Vaccination and Immunization in UK, was clearly in favor of vaccination of all the pregnant women in UK. And that's with Pfizer or Moderna, because these are the two vaccines in which the studies were done and tested. So let's just talk about these studies. This is one of them. This is a study which published in JAMA, which is a famous American journal, and also licensed by the NIH. And that study was sponsored by Harvard University and this medical center in Boston. And it involved, if you look at the study itself, is not a huge study. It's 103 women aged 18 to 45 received these vaccines between December till 20 to March 21. And after this vaccination, the important thing they found, the antibodies were happening in their blood, in the opposite, neutralize all variants of concern. All variants, I believe at that stage, Delta variant was not popular, was not known. So at that time, probably the one we know, the Alpha and Beta and all that, but not probably the Delta variant. But till now, this advice could be extended to all variants, and by all variants, we mean even the Delta variant. And the interesting thing, this is smaller study found this antibody can be found in the infant cord blood and also can be passed in the milk of the mother. So that's very good kind of recommendation to tell the women, hey, look, there's a study there showing all that you're protecting yourself, not only yourself, you're protecting your baby. And then there is another study which happened in Chicago and published in the Journal of Obstetrics and Gynecology and conducted by Jeffrey Goldstein and Northwestern, also kind of confirmed the same finding. This is a slightly smaller study. There was 83 patients or 84 patients. And in that study, they also were studying the effect of the vaccine on the placenta, and they could not identify kind of boost for the recommendation for the vaccination. And thank you very much.
Okay, thank you so much, Dr. Ali.